Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Gio Mormont. Gio has been really good at oiling this left ear, probably because he has a lot of time during his night's watch to do this every evening. He needed super heavy oiling on this side at the last appointment he had with me because there was no point in even starting the earwax removal then, because the keratin had built up and was rock solid dry and stuck to the ear canal wall. His ear canals become very narrow at the middle, and when the probe goes in, you can see it hits the side of the ear canal wall. And this keratin, although it doesn't look like much from where it is, there's actually quite a lot behind the angle that we can see. And as the end of the probe attaches to the earwax, it's gently pulling it out, and suddenly a little area comes away. Now this area here, you can see it looks a little bit odd. There's little fibres that are attached to the surface of the wax, and that's because he's been using cotton wool after the oiling, packing it into the ears, and that's migrated down into the rest of the earwax. So I'm going back in now and I'm trying to reach that part that has broken off from a different angle. And although it's attaching and some keratin is coming off, it's not quite being suctioned up by the probe like I would like it to. There's a lot of movement here and chopsticking where the probe and the camera are trying to get space, and they're bouncing off each other, but eventually we get a slightly better angle where I can see everything and the probe attaches to the wax. Some readjustment there. And slowly the wax again has come off. There's two pieces there. One is being held on by the little fibres, and you can see it's quite a big piece. Now I'm re-entering the ear canal, and there's a small piece at the bottom there which I'd like to remove. I'm trying to get those little areas on the periphery first to neaten things up, but again you can see that earwax really does have a lot of fibres in it, and immediately it attaches and goes straight into the probe tubing, and there's a little bit being held on to the tympanic membrane or the eardrum as the suction is near it. Some readjustment on the brace there. Now here's a mid-procedure shot of the eardrum. Everything is super red, a little bit upset, but what I really wanted to show you were the fibres of the cotton wool inside the ear and actually on the eardrum. You can see these fibres are stuck to the wax on the right-hand side of the screen, and it's quite evident that it's on the eardrum as well. And there's going to be no real way of taking that out, so we're going to clear things up as much as possible. But those fibres should migrate out of the ear with time. And the reason why these little fibres ended up there is because Gio is actually quite heavy-handed, and I found that when he was oiling his ear, he was really packing the cotton wool in the ear in an attempt to keep the oil in, but as he was doing this, he was leaving bits of cotton wool inside his ear. Now I'm going in, attempting to remove those pieces deep in the ear canal. Suddenly you can see that there is quite a lot there, kind of attached to the side of the ear canal. Again, it looks really, really fibrous, which it shouldn't look, mixed in with the keratin, and very white as well. You can really see those fibres. Here's the final beauty shot of the left ear. Very red, as we were saying before, and I'm not surprised, because essentially had a foreign body inside the ear, which were in the form of the cotton wool fibres. There's still some oil in there, and you can see some fibres remaining on the eardrum. Now let's go over to the right side. Again, the ear canal gets very narrow towards the end, and the keratin has been quite heavily oiled, which I actually did for the patient before the procedure, as he'd only done the left ear. As a suction probe goes in, straight into the tube, suddenly you find very quickly it goes right into the suction probe, and a little bit more that's come away there. Nice large piece, and a freeze frame on that. And you can see it's a little different, this piece. It doesn't have those fibres in it because he has had no cotton wool on this side. Back in. And you can see there's quite a lot in the anterior superior region, which is a complicated name for the area closest to the face or the nose. And a large keratin layer is coming away here, quite thick and quite long. And overall, the surface texture of this piece of keratin is again very different from what came out of the other side. There's no cotton wool fibres stuck in it. So we're back in, and there are a few peripheral areas I want to deal with. Some going very rapidly into the probe, and a little bit of a skin pull here. Quite silvery in appearance. We're going deeper down to try to get more of it, and suddenly we do have an attachment on the end. Again, quite a large, long piece, and it's broken into two there, so that's the first little piece that has come away. And I'm going back in to get the second piece, which broke off. And that attaches on there nicely. Again, a smooth textured piece of keratin layer, which is how I would expect it to look. A small amount of tidying up to do now. There's a small piece of keratin right at the top. So being very gentle because it is sitting right on the eardrum. Time to try again. I do tend to rebrace quite often if the angle is not good. And here you can see a very, very nice angle, a good view, and I feel like the tip of the probe is very much in control. Very gently, trying to almost just touch the surface of that little piece of wax. I'm going to go back in and try that again. That little piece will stop the eardrum from vibrating as well as it should do, so I do want to get it out. So very, very gently, and suddenly we get some of it. And as I'm coming out, there's a few bits just at the periphery and a nice skin pull there as well. Little hair that just went straight into the probe. And again, just trying to get that little bit at the top. There, that's come off. It went straight into the probe. If you blinked, you missed it. So, here's the final shot of the eardrum. You can see it is quite red. There's little scraggly pieces of peripheral keratin not ready to come off, but it's not as agitated as the left ear because there was no cotton fibre inside the ear canal, which would essentially be seen as a foreign body. A little bit of a 360 view there to check all of those crevices. So that's the end of episode 19. I had a comment from Pippa C Spirit 4415 asking, could you please show us the wax that has been removed next to a ruler so we can see how much there was? Of course, I'm going to get a nice Veritas blue ruler from somewhere, and I will attempt to show you that in the next few videos. Sometimes with extractions like this, you would be quite surprised about how small the amount of wax is that has come out. So when we do have a larger amount, I will do the ruler method and show you how much there is. So thank you all again for watching. Please do continue to like, subscribe and comment, and I will see you in the next one.